Clinicians are looking for a better way to manage complicated, recurrent, or persistent urinary tract infections, especially those in elevated risk patients. Complicated UTIs weigh significantly on the healthcare system, contributing 10.5 million office visits each year and an annual cost of approximately $3.5 billion. There are clinical challenges for effective UTI management with standard urine culture and sensitivity, the current standard of care. These challenges include pathogen detection and identification. Culture has difficulty detecting fastidious organisms and yeast. Time to results. Culture can take up to 3 to 5 days for results, leading to increased empiric therapy, which in many cases will not appropriately treat the infection. Polymicrobial infections. Up to 52% of UTIs are polymicrobial, which culture might report out as mixed flora. Missing information. Standard culture and sensitivity does not account for bacterial interactions that occur in polymicrobial infections, which may alter antibiotic resistance. An advanced UTI diagnostic is now available, backed by real-world clinical evidence. Guidance UTI leverages unique technology to transform patient care and champion antibiotic stewardship with precision identification and susceptibility results, all in less than 1 day. Guidance UTI helps providers direct personalized treatment to resolve infections and complicated UTIs. Compelling evidence comes from real-world evidence, which can tell us what actually happens when an advanced diagnostic test is used in typical clinical settings compared to current standard of care. Previous evidence has already shown a 13.7% decrease in hospital admissions and/or emergency department utilization when compared to the use of standard urine culture testing. New real-world evidence shows that Guidance UTI testing is associated with reductions in critical UTI-related healthcare resources use and cost. This evidence outlines a comparison of Guidance UTI and standard urine culture for rates of sepsis, hospitalization, and other adverse outcomes in complicated urinary tract infections. A random 5% sample of Medicare Parts A and B beneficiaries enrolled in 2017 through 19, N 1.5 million in each year, was analyzed. To control for other factors that can influence UTI-related outcomes and bias the result, such as diabetes and gender, the Guidance UTI and urine culture cohorts were propensity matched. After a 12-month baseline, patients with a complicated UTI event were followed for 1 year to assess UTI-related adverse outcomes and costs from professional and facility claims. The rate of outpatient emergency visits was 13% lower, and inpatient admissions was 67% lower when using Guidance UTI compared to standard urine culture. There were no urosepsis, urgent care, or skilled nursing facility admissions with Guidance UTI versus 51 cases per 1,000 using standard urine culture. Guidance UTI testing was associated with a 42% reduction in emergency department, urgent care, SNF, and inpatient admissions compared to standard urine culture. These reductions translate to $463.46 in savings per complicated UTI patient tested with Guidance UTI versus urine culture, a savings of $11.6 million for every 25,000 complicated UTI cases. Initial data shows diabetics are an important population to understand, and further studies are planned. Guidance UTI has numerous clinical studies and peer-reviewed publications to demonstrate improved test performance, patient outcomes, and reduced healthcare costs. Guidance UTI provides personalized results, including antibiotic susceptibility in less than 1 day from receipt at the lab. At Pathnostics, we move patient care forward.